performed a pioneering service as the Director MRI and Direct Information of the Ministry of Health. Let's put our hands together to Sigo and entertainer at the story night. Yes.
Yeah, as I told her that I'm going to present the most weird story. You can see this photo, it's one of my family photos. So, because my life has been, many mentioned that they are how they enter into public health. I entered into public health by my, can you go back? Go back to the, yeah. So I see, yeah. This is my father and this is his brother. He was a British World War veteran. He worked in the British Army and you know, yeah. And when they came back, he went to Italy and Egypt and all that. They came back. They were offered this sanitary inspector job. So he became a sanitary inspector. And this photo was taken very much before I was born. My eldest brother is there. And this is the day they took the sanitary inspector job. It was a well-respected job. He was one rich man in there. He was the richest man in the village. It's Kadavata, not far away. It's 10 miles from Colombo. And that is somehow my connection. Then next photo. Yeah. As you know, Santusha, and with the, I have luck with ladies. Even in the ministry now, even now I am surrounded by most beautiful public health specialists, Vidya and Janaki. And from birth I was lucky because this is my house and this room was public health midwife's office. Because of that, my uncle's connection, this room was from 60s to 70, is we call it Stopu Kamre, is used as a midwife's office. So I was lucky. From day one, I was looked after by a midwife at home. Yeah. So then, next. Yeah. As I was supposed to discuss about the information, when Dr. Hemant was reading about the malaria epidemic, I have the figures. So this you Karavanalla 574, Kagalla 1135. Like in the third, make it තියෙනවා මේ වසංගතයකටත් වඩා දරුණු විය උතුරු නැගෙනහිර පළාත් අතර මුළු ලංකාව ලෙඩින් බඩසයින් පිරුණු දේශයක් බවට ප්‍රොෆෙසර් තිස්සකාරයෝ did not tell. I have all the figures. I was showing Dr. Santusha that when you mention about Karavanalla, Mavanalla, all the figures I have. And that is one of the worst epidemics. That's how the information, yeah, you can see some. One of the worst, it's all over the country. It was in Gampa, near Colombo, as in Kalani also. So it was a kind of all over the country. And that really changed the entire, I think, demography and everything, because they used to say, as you mentioned, virtually every family somebody died. That's what they used to say. So like that, there's the information. So I was supposed to talk about the information system. So in the pre-1990s, actually it was mostly, even Dr. Chitramali spoke about this, so I don't talk much about the information system. In 1990s only this electronic system started. Till then all the paper-based systems. In 1997, IMMR called in transition to ICD-10. That is one crucial point. Then in 1998, establishment of Health Informatics Society of Sri Lanka happened. We are, as you know, we are one of the, other than USA, we are the only country nation, one country, we started these doctors doing health informatics. There are pros and cons, but that's other than USA, Professor Vajra is here, the pioneer, and it was established. And 2009 and 2007 to 9, initiation of health informatics discipline at MSc level. Citizen, is it correct? And 2007 to 9, the development started. Then 2009, IMMR, Electronic Indo Mobility and Mobile Return started. Then one major event was in 2010, National E-Health Steering Committee was started. That is where under the Secretary Health. And like that, as I was Director Health Information, I also was involved. One major issue by the time I reported to duty was this: there were two systems. You all know that HIMS and HHIMS. That are the one major issue, because actually there was little antipathy between these developers and workers also. That is one of the, I take it personally, because somehow I used all my communication skills and brought them together. It was the secretary was Dr. Sanjeev Munasinghe. That time we got the developers together, ICTA and our own doctors together, got the agreement that they are going to work together and develop one system. So after my time there, Dr. Palitha Karunapayama, he started with ICTA and they developed that one of the essential thing was the blueprint. So to have all these, there were about 22 or nearly 30 systems. They were not, we couldn't put them together. So one major important issue was to put them together. So that the blueprint was developed. It is now, it's there now, but it took a long way to develop. And during that time, this global fund, madam, has there is a project called HIQI project. I was the director for a very short time. So that really started, supported this developing the blueprint. So like that, this health system, it's a long way to go. And but one good thing is that, can I please play the video?
Since the outbreak of COVID-19, more than 30 countries have begun to use it as a platform for COVID-19 surveillance. Sri Lanka was the first country to use this software as a tool against the pandemic. The innovative approach they developed was then shared and adapted for global use. The rapid rollout of this new tool would not have been possible without the existing collaboration between countries already using this platform. The pandemic has further strengthened Norway's commitment to work with public and private partners to ensure access to quality digital solutions. The pandemic will require international collaboration and globally coordinated action.
Yeah, as you can see, it's a short video.
The COVID-19 pandemic has shown us just how important
as you can
digital
see,
solutions are.
Sri Lanka, in our information unit, is the first country in the whole world to start using the health informatics for the control of, management of COVID. This is the Prime Minister of Norway is saying. So we are the first country, I think. Professor Vajira, you should be very proud, because we, his children only started this job. Though I was a public health specialist, that time I was a director of health information. So like that, starting from the epidemic, the malaria, we came a long way. So we are updated, and even in the WHO meetings and all that, we are always given the priority. We chair a lot of meetings when we go to. So I think we are in a good situation. As the last one, as many stories, as you know, I am a writer. So this is the book. It's published by Godagi. There are many stories related to. If you are interested, you can read the book. Thank you very much.